Good afternoon, long-term care community in Alameda County. Thank you for logging on with us today. My name is Nicole. I'm the Executive Director for Ombudsman Services. I'm here today with David Farrell from Alameda County and Ron Seitz. They are leading our efforts around long-term care mitigation and infection prevention and have some important information for us today. I want to start off by saying I apologize. Last week's recording, there were some technical issues, so I'm sorry we were not able to record that, but we are recording today. Just a reminder that any slides and recording will be shared with all registrants following the meeting, and we encourage you to share this information with your staff and the broader community because this will help everyone to be prepared. And so with that, I want to turn it over to David. David, thank you so much for being here today. David, we can't hear you, so if you're there, maybe see if you're on mute.
How's this?
Much better, thank you.
Yeah, it's always embarrassing to talk to yourself when you're on mute. But once again, this is David Farrell, and thank you so much for taking time out of your busy day to join us for this afternoon's webinar. We've been running a series of webinars for RCFEs and assisted living facilities, adult residential facilities, every Monday at 2 to help you to contain and mitigate COVID within your communities. You know, we care about you, we care about your residents, we care about your staff, and if there's anything that we can do to help, we're here to help. But before we jump into today's topic, I hope that many of you joined the call that just concluded that was led by the Department of Social Services that provided an excellent update on the vaccine and the clinics that will be rolling out as part of the federal partnership with CVS and Walgreens. So we just wanted to see if there were lingering questions or any questions that you have related to the vaccine, and just open up the floor at this time. Perhaps you listened in and you weren't able to get your question answered at the webinar that was just concluded by the Department of Social Services, and certainly you can ask that question of us and we'll do our best to provide you with an accurate answer. So I know that Nicole, you joined the webinar and I did too. I thought it was really helpful and provided just a lot of concise information to get us prepared for our clinics that will be held as part of the partnership. So any questions or concerns about the vaccine?
Yeah, excellent. I just want to encourage everyone to go ahead and drop your questions in either the chat or the Q&A. Either is fine, and we will ask those. So everyone, I'm sure everyone has the same question, so please feel free to bring things up. David, I thought that was a really interesting call, and I thought it was really one thing that came up for me that I want to make sure everyone heard is, you know, they said, hey, we sometimes have outside employees like home care or home health that a family retains or another care partner to care for a resident and ask, how should they be included in the vaccine rollouts? And I thought that was a really important, because I know many of our facilities also include care partners from outside of their staff in their building. And that really recognizing that those folks should likely be vaccinated by their employer, but that if they are in their building, they absolutely should make sure they are getting vaccinated.
Agreed. Anyone who's providing direct care to any one of your residents, whether it's an outside agency or your own staff, we want to protect your residents, and the best way that you can do that is to ensure that those providing the care have received the vaccine. So whether that is something that you extend to do as part of your clinic, we can certainly pose that question to Walgreens and CVS. We're in direct contact regularly with CVS and Walgreens. We're starting to see that they're starting to schedule the clinics. We have clinics going on right now as we speak in some of our skilled nursing facilities here in Alameda County. So it's really encouraging that we're talking about the vaccine and figuring it out together. It just gives us all a ray of hope that we're going to get through this together.
Now, Jocelyn asked, and Jocelyn's had some great questions over the last couple weeks. So she asked, where can they get a consent form for the immunization? And so I wonder if maybe you can reflect back to the call and what we just learned on the call and how facilities should handle that.
Yeah, well, CVS and Walgreens both have their own consent form. And while federal and state law do not require a COVID vaccine consent form, these two pharmacies or business entities felt like they needed to have a consent form in order to protect themselves, considering this is a novel vaccine for the novel coronavirus. So they do have a 2-page consent form, and they are really looking that for most of these consent forms to be completed before they commit to coming on site and doing a clinic for you. So each of their consent forms is, there are copies available both on their websites or we have copies that we could send to you. But it's super important that if you are a part of the federal partnership, that you do comply with either CVS or Walgreens requirement of this consent form. I know that on the call, you may have heard, well, it's not required. There might be other avenues. However, that may slow you down with this federal partnership, and it would just be a shame if that were to occur. So if you'd like to get a copy of the consent form, we can make sure it's available to you. When we send out the summary of this webinar, we'll attach it along with the slides.
Absolutely. Let's be sure to do that. And, I think this brings up an important question because I was listening on the last call and they sort of started with like, what do? You're going to fill these paper out ahead of time. And then they've heard from some providers that you then need to provide essentially the same information when they are on site. So I just want to encourage everyone, when you're completing the information and you submit it online, just retain a copy of that and have it ready for when the vaccine clinic is at your location. I think that'll speed things along. And I know that's hard in time. We're managing a lot of paperwork and a lot of different, moving deadlines. But if you could just really, when you're submitting the information, please retain a copy. And I think that will help you to expedite the clinic at your building.
Yes. And some of these early growing pains of these first clinics that are happening around the country where we're learning about the duplication of paperwork and things like that, we'll give feedback to CVS and Walgreens, and hopefully we'll work through all of that before your clinic is scheduled. So in some cases, it's okay for a couple of skilled nursing facilities to go first, where we can work through some of these issues so that by the time your clinic is scheduled, those issues will be resolved. That's what we're hoping for.
So David, you spoke to this point last week, and I think you did a really good job of, you talked about what to do if a caregiver declines the vaccine. How should RCFE administrators handle that?
Well, you should be really sensitive, and you should be respectful, and you should consider that this is an individual's decision. And also understand that not everybody is going to show up at your first clinic raring to go. Last week, we gave you resources and we talked about your need as a leader to overcome vaccine hesitancy so that you could increase the uptake and the percentage of staff who accept the vaccine. But in some communities, your staff are just going to have to see their colleagues get vaccinated, and they're just going to have to hear from their colleagues that the side effects were very minimal. And then you'll have another big wave of staff who will be opting in to get vaccinated. So your early adopters or your staff that really want the vaccine, let them be first in line, encourage them to share everything that they're experiencing with their colleagues, and many of them will see their peers, listen to their peers, and then decide to get vaccinated.
Let the cool kids do it, and then everyone else will follow, right, David?
Exactly. And remember, you're going to have 3 clinics scheduled, and therefore, you definitely will have some laggards who won't get their first shot until your 3rd clinic. So don't think of this as a one game affair. This is a 3-game series, and your goal is to have a high vaccination rate at the end of the 3rd game in the series.
Absolutely. And I just want to remind something that they mentioned on the last call with CDSS, which is in terms of side effects, so far they've been a little more pronounced with the 2nd dose. So just to plan for that in your staffing is that, they recommended that if your person is getting their 2nd dose on, let's just say it's a Wednesday, that be their Friday, if at all possible, and that they be off the next couple days, because if they do have a fever, they're going to call in and you want them to, of course, do that. And so just plan accordingly with your staff that you may need backups during, sort of following your clinics. And so just plan ahead for that, always plan for the worst and hope for the best.
Yes. But thankfully, we're hearing very few adverse events or major side effects that would lead someone to have to call off after the first shot. So that's encouraging.
Excellent. Just want to encourage everyone to drop their questions in the chat or Q&A. And we have a facility administrator that says that their facility is not registered with the federal partnership. What can they do in order to make sure that their residents and staff do receive the vaccine?
Yes, that's where the county or Alameda County will step in. We've received a list that came this weekend of all the facilities in our county that are enrolled in the federal partnership program. However, there are a good 58 facilities that are not enrolled for one reason or another. And so Alameda County will be looking at that list and planning to serve your needs with the allocations that come into our county. So we'll be working with you as opposed to the Walgreens or CVS. And go ahead and please put your facility name in the chat box so we can get that. And if any of you know for sure you're not part of the federal partnership, please go ahead and put that in the chat box or email myself or Renee.
And Renee, would it be possible, because I think you offered this last time, that if people can, you'll drop your email in the chat and people can email you directly. Would you mind adding your email to the chat below and maybe saying it out loud as well, so folks who are on the phone calling in?
Yes, definitely. So as a reminder, all of the RCFEs were automatically enrolled, but if you haven't heard from CVS or Walgreens and you want us to double check that you are on the list for the federal partnership, go ahead and email me. My email is Renee, RENEE .yun, YUN for Nancy, at acgov.org. And I can double check if you are on the list or if Alameda County will be working with you directly.
Thanks, Renee.
So David, we don't have any other questions in the chat right now. Would you like to go over your PowerPoint, and then to remind everyone, if questions come up, please drop them in the chat or the Q&A and we will get to them.
Sure. Let's talk a bit about the complexities of cohorting as well as PPE use in residential assisted living and adult residential facilities. So here's some of the things that we want to cover, and I think it's about 23 slides here, so I'll move fairly quickly. So when it comes to, RCFEs and residents living in their own apartments, if we have an outbreak, certainly we're thinking about how we can cohort or establish the status of residents in order to minimize the risk of exposure and prevent additional spread. So of course, last time we focused a lot about testing and why testing is so important. And with this this slide deck, now we have our test results, which now enables us to be able to clearly communicate to everybody what status everybody is. And in some facilities, you would have the ability to physically cohort residents who are of a certain status. But in most cases, really you're indicating what status they are outside of their apartment. So of course, there are kind of 4 statuses, if you will, when we think about cohorting during an outbreak. We'd have those residents who we know just tested negative, or perhaps we didn't test them because they're COVID recovered and still within that 90-day period. So if you're COVID recovered, you're negative, no reason to be tested. So you might have a group of residents that would fall into that category. You might have a large yellow group. Usually the yellow status or cohort is always the largest because there's such a variety of different types of exposed residents or unknowns that would fall into that group. But generally, the yellow status would be for new or readmissions, where their status or their exposure is unknown, or you'd have those who you know had been exposed, but you don't have their test results back yet. Those that you had to put into quarantine because they were exposed would be in that yellow zone. Those who've had perhaps close contact with a staff member who tested positive would certainly suddenly become a yellow status or in the yellow zone. Or if you just had a suspected exposure after contact tracing of your staff who tested positive. Then, of course, there's that category of residents who are symptomatic. They tested negative on their most recent test, but all their symptoms would indicate that they do have COVID-19 and you're simply waiting for their results. And then, of course, you have the COVID confirmed. So each resident in your organization would need to be designated as a certain status. And of course, the job of leadership is to be constantly communicating to all your constituents, the residents' families, guardians, staff, what the status of each resident is, so that everybody could be properly cared for with the right PPE and also carefully monitored to determine if their symptoms are exacerbating. So there's a lot of challenges with RCFEs, and really the way that you overcome the challenges is to test more, not less. And in many cases, we are experiencing that a lot of facilities think that testing every 7 days is adequate when dealing with an outbreak, where in reality, the truth is that the guidance has always been to test every 3 to 7 days, with 7 days kind of being the last day out there. So the more testing that you can do, the more you're very clear, of course, about each resident's status and understanding the true extent of the exposure that may be within your facility. Many residents have no symptoms. And as we discussed during the very first call, about 40% of individuals that have COVID are pre-symptomatic or asymptomatic. However, many of them are carrying a very high viral load and can be super spreaders, if we can use that term. So we want to make sure that we're testing and recognizing that monitoring for symptoms of COVID is probably the worst way to do surveillance. Aggressive testing is the best way to do surveillance, and that's why the testing requirements for RCFEs were increased by Alameda County. Now, if you can do it, you'd like to designate a separate space for positive COVID cases, but in many cases, our RCFEs and adult residential facilities just simply can't do that. And in some cases, moving residents around if their test results are 3 days old, can be a very dangerous thing to do. So really, we just want people to hunker down, if you will, stay in their apartments until we can get a handle on the outbreak. So when one case is detected, we often believe that there are other resident cases out there as well. So in some cases, we might designate a whole RCFE as a yellow unit or a yellow zone until we can determine truly who's negative and who's positive. In some cases, we might designate the second floor of a large assisted living community as yellow until we can determine truly what the outbreak status is within that second floor. So it's always good to be super cautious when an outbreak begins and consider that it's likely that people have been exposed. In addition, you want to make sure that, again, you're clearly communicating everybody's status, as well as measuring and monitoring the number of days that people have been in isolation or in quarantine. So as I mentioned, we'll lock people down. We want to determine the red, yellow, and green status. We want to designate that status, make sure everybody clearly knows before they go in the room with visible signage that would also indicate what PPE is required to be worn before assisting the resident in that room. And of course, anyone of a red or yellow status would be full PPE with an N95 respirator. In addition, I think most of you know that if you're using a respirator, an N95, then you also must have fit testing. And fit testing is required in RCFEs and any community that is using an N95. As I mentioned earlier, in the early stages of an outbreak, a whole wing or facility may be deemed yellow until a full round of test results is completed, and you want to keep everybody informed. If people feel like there's a gap in communication from the leadership team, they tend to fill that gap with negative information. So if you want to stay on top of keeping everybody well informed, you'll also prevent some of the negative rumors that can surface if there are gaps in communication. So here's just a layout of perhaps what a facility can do if they find a suspected or confirmed case. This, of course, is a picture of a nursing home, but I just wanted to, clearly articulate for you that in an assisted living community, if that was an apartment where we had a suspected or confirmed case and we knew that that resident liked to travel down the hall and visit with individuals next to her room, then we would want to designate that area as a yellow zone and begin aggressively monitoring those residents and making sure our staff wore the appropriate PPE for all the residents within that section. We also want to make sure that all new or returning residents to your community are given a yellow status. Because of the widespread number of cases, a positivity rate that's up to almost 10% in our county, you really want to assume that new or readmissions have probably been exposed. Therefore, you'll want to quarantine your new or returning residents and give them a yellow status. At the end of that 14-day period, certainly you can test them. Testing them on day 5 or day 8 won't get them out of the 14-day quarantine period that will still be required. So it's probably best to just test them at the end of the 14-day quarantine period. That would be the best approach. So we take immediate action. So far in our little series, we've covered screening. Now we're reviewing resident placement or cohorting, and now we'll jump right into PPE. So there are certain types of PPE, of course. I'm sure you've all become familiar with them and how expensive they all are right now. Early on in the pandemic, when PPE was in short supply, there were some waivers and considerations given for whatever you can find. However, that is not the case anymore, and facilities are expected to have the proper PPE to care for each one of their residents in terms of their status as red or yellow. So all facility personnel should be wearing face masks, surgical face masks, if you're not in an outbreak, of course, at all times. If there are COVID cases, healthcare workers should wear the recommended PPE for each resident according to their status. And as I mentioned, you want to clearly show everyone what type of PPE should be worn before they enter that resident's room to provide care. There's plenty of information on PPE on the CDC website, so please refer to this link in this page when you're trying to optimize your supply of PPE and do it legally. Good questions to ask. Do we have 3 weeks of PPE on hand? If we were to have a full outbreak and our whole community was a red zone, do we have 3 weeks of PPE on hand? That's a key question to ask, and that's what you want to plan for. Number two, are we aware of the CDC contingencies for shortages and how we could extend the life and do that legally of our PPE? We'll want to be aware of that. Have you trained your staff in the proper selection and donning and doffing? Where a lot of mistakes are made is in donning and doffing the PPE, especially for housekeepers who may be unaware of the necessity to do it in a particular sequential order. Is the right PPE available outside each room with proper signage describing what PPE should be worn? Is it easy for staff to discard the PPE in a strategic location near the exit of the room so they can be in compliance? If COVID cases are in the building, are staff wearing the correct PPE to care for the yellow and red residents? Do residents wear face masks if they have to leave their room? And are employees wearing face masks in the facility? These are all good questions to ask. And many of you are aware that 3 pins were released last week, just before the Christmas holiday. And one of them is requiring all the RCFEs to develop and create a COVID-19 mitigation plan, which is due on January 24th, 2021. And within your COVID mitigation plan, you'll need to articulate answers to all of the questions that you see here as part of your plan. So please gear up for that. In addition, all the skilled nursing facilities have had to develop a COVID mitigation plan, and that's been in place since May, I believe, of this year. If any of you needed examples of mitigation plans or any help or advice around the mitigation plan that you're working on, don't hesitate to ask us. We'd be happy to help. In addition, we updated all of our guidance on our website, and certainly that guidance can be helpful when developing your mitigation plan. Most skilled nursing facilities and some RCFEs and other long-term care facilities have been using a CDC burn rate calculator for months now. This is really the easiest way for you to determine if you have 3 weeks of PPE on hand without having to go and count the boxes within your central supply area. So please consider adopting and using the CDC burn rate calculator to keep everyone informed how much PPE you have on hand. If you were running out of PPE, this is how you could request it from Alameda County Public Health Department. So here's the link and how you would get in. If you have never used this account, please create an account before it's an emergency. Perhaps if you've never had to tap into this resource, at the end of this webinar, please create an account, because you certainly don't want to be waiting for approval when you're in a state of emergency in need of PPE or other supplies that are in our warehouse in Dublin. Here are some pictures of the signage that we would expect to see outside the apartments or the rooms within your community in consideration of who might be of yellow or red status, so that everybody is very clear on exactly what should be worn before they go in and care for the person in that room. Donning and doffing isn't easy, but there are plenty of helpful videos for you to show your staff, and you'll certainly want to be monitoring and watching staff don and doff PPE and giving them tips and insights if they need some improvement. When people wear the right PPE and they wear it properly, their chances of being infected are very, very small. However, if they do not don and doff properly, if they're not wearing the equipment properly, that's when they could be exposed and be at risk. And there's really helpful tools for you to use to monitor your staff donning and doffing. And so here's an example of a tool that you could consider using to walk around the facility and do some auditing to determine if people are donning and doffing properly. And we provided you with some references as well that were helpful in pulling these slides together. So that kind of wraps up that slide deck there, and now we'll open it up to questions and comments from the audience. Thank you.
David, I just wanted to offer that, you referenced the pins that came out last week, and I want to let everyone know I put the link to access all the pins from CDSS in the chat. It's a great way to make sure that you can also sign up for the pins, and they're emailed directly to me and my staff, and that's very helpful. And I also wanted to reference back when you were talking about testing for COVID-19, and our partner Armando Vallon from Kaiser Permanente in Southern Alameda County offered that for if there's a resident that is an RCFE member of Kaiser, and they're at an RCFE resident, that Kaiser is doing testing for them. And I just want to attest that also as a Kaiser member, it's very easy to get testing through Kaiser when necessary. So again,
Yeah.
Armando, did you want to maybe chime in and talk about that a little bit?
Absolutely. Hi, everyone. Hi, Nicole. Thank you for that small introduction. If you don't know me or have not interacted with our department, my name is Armando Vallon. I am the manager for the continuing care SNF departments, memory center, life care planning, and now the RCFE COVID suppression project for Kaiser Permanente, Southern Alameda County. And we've been offering on-site testing for RCFEs who have Kaiser Permanente residents. We come on site, we do the swabbing, we do it on a weekly basis. We provide you with results. And for staff who are Kaiser patients who work at your facilities, we also can provide not on-site testing, but through our drive-through, but we'll take over the scheduling so that each of your individual staff doesn't have to worry about having a steady and consistent appointment. We'll take over that. And that would facilitate the process and ensuring that your staff get tested weekly through our drive-through, giving them some sort of priority. And so just a reminder for those facilities who have not heard that we provide the service, and we're currently testing 6 RCFEs. So we're very busy. We test on Tuesdays, Wednesdays, and Thursdays. We send a team of doctors to your facilities. Any questions, please let me know.
Armando, we're getting shout outs to you in the chat of saying how great it is to work with you and your team, and a request of if they do want to reach out to you, how can they contact you? So would you mind putting that in both the chat and saying it live as well?
Absolutely. I'm going to put my email and my my phone number on the chat. Please feel free to use it. I work 24/7. I don't get a break, so I will always answer my phone and help you out. We try to respond as quickly as possible, given the weekend. But we're here to help you. And I think our message to you as a facility is that we want to partner with you. We understand that this can be an overwhelming process. So we want to partner with you to make it easier to share that burden. And so for those facilities that we currently work with, Stephanie Bryce is one of them. We love working with you.
Mhm.
Thank you so much, Armando. We really appreciate you and your team, and especially working so hard during this time.
Thank you.
So David, a couple questions popped up around the vaccine, and the first is how should they handle it if they have a staff member who's pregnant? What does the vaccine, what testing has been done? How should that staff member handle it? What should be the process?
I have to admit, I haven't honed in on that particular, scenario, so I'm not sure. But I did hear an interview on NPR where the individual was saying that she was going to wait a little bit and determine how things go with people getting the vaccine before she decided to get it. But Renee or Ron, anyone hear anything about what the guidance is related to accepting the vaccine if you're pregnant? We will find out, okay? Good question. I see another question here related to if someone had a COVID positive test a month ago, can't she get the vaccine? And the answer to that question is yes. Individuals who have had COVID in the past do have some natural antibodies that they're working with. However, you would definitely want to get the vaccine so you can get an extra boost of antibodies that the vaccine will provide. So for sure, individuals who've tested positive for COVID in the past should get vaccinated.
So we have someone from a 6-bed facility saying, that they're trying to take in a new resident who has no COVID symptoms, but this resident is really finding it a challenge to get their COVID test prior to moving in. They just can't get a testing appointment. Do you have any resources that you can offer as to how they can get that test to allow the resident to move in?
Yes, if the resident can tolerate it, then I would drive the resident to one of Alameda County's community testing sites and have them tested there before being admitted to the community.
Mm-hmm. And where can they find out about those testing sites? What website would they go to?
They would go to the COVID page of the Alameda County Public Health Department website and click on testing.
Okay. So David, we don't have any other questions in the chat, but I just want to give everyone a few minutes to reflect and feel if they have any other questions, feel free to drop it in the chat or the Q&A. And just a reminder, if you think of something after the phone call, feel free to reach out to any of us and we will definitely get you the answer. Oh, we have one. So can you talk about residents transitioning back to their home, RCFEs, after testing positive for COVID? So just to clarify, what I'm hearing in this question is maybe the resident had COVID and maybe went to a hospital. If you guys can clarify that. But basically, how should they transition back to RCFEs from another setting? What's required of them?
Nicole, this is Armando. I asked that question from Kaiser Permanente, Armando Bain. And so part of our challenge is that, let's say a patient goes to the hospital for X reason, and then the patient is tested automatically for COVID. And the patient sometimes is fine. They don't have symptoms that will require them to stay in the hospital. So then we're finding a lot of challenges, facilities accepting the patients back. So most of the time, I would say 99% of the time, we work very closely with the RCFE administrators to create a transition plan. But I think it's very inconsistent, right? Each facility has their own process. So is there a way that we can standardize that process to transition these patients back to their home RCFE? Thank you.
Yeah,
Yes,
David,
and
do you
I
wanna
think,
go with policy?
yeah, I think I covered that in my slide deck, where you should all be able to safely take a resident back from the hospital or back from a nursing home without knowing their status. By accepting them and designating them as a yellow status and under quarantine. And essentially you're saying this resident is presumed positive, and we're going to wear the right PPE because we presume they're positive. However, we really don't know that they were exposed, because just because they were in a hospital doesn't mean they were exposed. But because the positivity rate is so high in the county, because COVID is so widespread in California right now, we're going to take these precautions in order to safely accept this resident back. So that's really kind of the best approach. And but we definitely don't want your residents to linger at higher levels of care, like an acute setting or in a skilled nursing facility. That really does a lot of detrimental things to the whole system of care, especially during this surge when hospitals are overwhelmed. The safest place for your resident is probably back in their apartment, under the watchful eyes of the staff who know and love that resident, but also wearing the right PPE. So similar to skilled nursing facilities, you don't necessarily have to get a negative test in order to accept a resident back. Just accept them back, assuming that they're positive, put them under quarantine, and treat them carefully, monitor them closely, test them at the end of the 14th day, and then hopefully they're negative and they're of green status again. Does that make sense? Does that make sense to you, Armando?
Absolutely, David. I also want to thank you and your team. You've been tremendous in helping our patients transition back into their home. We agree with you 100% that most of the time the safest place is their home, right? And being in an acute setting is not necessarily the best place for them if their symptoms are manageable. So thank you for your help. And thank you for that explanation. That was very succinct. Thank you.
Yes. And if your folks aren't needing the level of care that an acute hospital provides, and hearing all that you're hearing about how care is being essentially rationed at the acute setting, you should assume that your resident will really not be getting much attention at that acute setting. And you could give them much more attention and much closer monitoring if they came back to your community.
David, I think you said it perfectly, which is right now we should all do our best to not be a burden on the hospital system right now. And that the sooner we can get them back to their home, the less at risk they are. And I want to offer to facilities, if you're feeling like it's a rational fear to like, I feel scared to bring them back, you can contact David's team. You can talk to Armando's team and say like, okay, so we want to take them back. We get that. How can we do that safely, right? And we can walk you through that. The fear is normal and we understand that. But the key is not to leave a resident sitting in the hospital for multiple days. And know that that it's also okay for you to talk to families about this as well and say, no, we know the safest place is back here in the building. So let's work together to make that happen.
Absolutely.
Yeah.
We also, oh, sorry. We also
Go
offer
ahead.
infection. Oh, sorry. Thank you, David. We also offer infection prevention education on site and online to help facilitate those fears. Right. We target that education for staff. We also provide handouts, a link. We have Arturo Fernandez, our senior health educator, available to you throughout the week. So we want to be a resource, like I mentioned earlier, to ensure that both staff and residents are safe.
Well said. And we had a colleague just remind us that if, for example, they have a staff member that does get a positive test, and that staff member is a concern to return to their home because of their family, that there are opportunities for those staff to stay at hotels. And you can find that information on with the pins that we provided the link earlier. So again, if you have staff that are concerned to go home, there are opportunities for RCFE staff to stay at local hotels, and you can find that information with the other pins.
Yes. And sometimes when you have COVID positive residents and you really need those dedicated staff to care for those COVID positive residents, a very good gesture you can make would be to offer that hotel room up front to protect their family while they're caring for the COVID positive residents.
I just want to do another call for questions in the chat or Q&A, or offer up. David, do you have anything else to offer for us?
Well, just seeing if there are any questions around staggering the vaccine. It certainly seems almost counterintuitive to be talking about staggering, yet knowing that really CVS or Walgreens are going to show up for 8 hours during the day shift and say to you, come one, come all. So it's really up to you to think about the possibility of staggering. And in many cases, staggering will be natural because not all your staff are going to want to get the vaccine the first time it's offered to them. So there'll be a natural staggering just based on vaccine hesitancy. Whereas we are finding that most of the residents opt in. So there's a high likelihood on the first clinic day that you might get 85% of your residents and 45% of your staff. And that's okay. Of course, considering what the purpose of staggering is so that we have the proper number of staff to both monitor the residents for their side effects after the vaccine, as well as enough staff to care for everybody that day. What we are learning is that a 22-year-old is likely to have more side effects than an 82-year-old from the first dose of the vaccine. So keep that in mind, as well as what I think Nicole shared, which is it's the second dose that tends to have greater side effects, because that's that extra 50% of antibodies that are now being injected into your system. So please consider that it's okay to have this kind of natural staggering. And as I mentioned earlier, your whole goal is a high percentage who took the vaccine at the end of the third clinic.
We have another request to make sure that Armando provides his contact information. I think it just went to the panelists the first time. So Armando, if you could put it in the chat to panelists and attendees, and if you wouldn't mind saying it again, I think that would be really important for folks.
Absolutely. Sorry, folks. So my full name is Armando Ballin. I'm with Kaiser Permanente, Southern Alameda County. My phone number is area code 510-468-2481, 510-468-2481. And my email address is armando.c as in cat and then my last name reads Vallin, but it's pronounced Vallin. So armando.c Vallin, VALLIN @kp.org. And I'll add it to both chats right now. Thank you.
Thank you. So just to remind everyone, we will send out the recording and the slides that David presented today, along with I'll include Armando's contact information as well, and a link to the pins and other resources we've talked about today, including testing in Alameda County and how to contact Renee if you want to ensure that your facility is on the pharmacy partnership list.
Yes, and I just provided a link for the CVS vaccine clinics. We'll also send you the link to get in touch with Walgreens. However, here in Alameda County, CVS has almost 90% of the facilities, and CVS will be doing clinics in about 90% of our facilities here in Alameda County. Walgreens only about 10%. So the vast majority of you will be served by Walgreens. I mean, CVS.
Excellent. And David, can you say that email out loud? I'm just, so is it COVID vaccine clinics LTCF at cvshealth.com?
Yep, that's correct.
Great. Well, I think that's the end of our questions. I just want to remind everyone that we will be back here again next Monday. Of course, the situation continues to unfold, so we'll have updated information. Please bring your questions and encourage others to join us. And as always, if you need to reach out to us ahead of time, we are always here for you. David, did you have any closing remarks?
Just thank you again for all of your efforts. We're all working so hard through this, and it's actually really encouraging that the CDPH triggered 1B to enable the pharmacies to start scheduling your clinics in a timely manner. So we're looking for clinics to hopefully start in the RCFEs and adult residential facilities beginning the second week of January. And it would just be wonderful to start to hear from you that you've been contacted about your first clinic. So thank you so much, everybody, and we'll be back with you next Monday afternoon.
Thank you, everyone. Have a wonderful day.